Hi, everyone, and welcome to Introduction to Healthcare Policy and the Nursing Professional. I'd like to ask you to take a few minutes to look through all of the syllabus, the modules, and the assignments, and paying particular attention to the program learning outcomes and the course competencies. So this is a picture of Elizabeth Warren, who is our Massachusetts state senator, and I believe has also announced she's going to begin exploring running for presidency. She says, if you don't have a seat at the table, you're probably on the menu. So what does this mean in terms of policy, in terms of nursing? Well, if nurses aren't the people who are sitting down at the table with all of the other decision makers, people who are looking at policy and procedure, then the decisions are probably not going to be to the nurses' benefit. So we need to be involved. Healthcare policy, we're going to talk about what it is, why it's important to us as a nurse at our facility level, state level, national level, and global level. Policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals. It defines a vision for the future, which in turn helps to establish targets and points of reference. Now, national health policies, strategies, and plans play an essential role in defining a country's vision. Think again about this in terms of your particular facility. If your facility has a vision, it is probably tied to its policies and strategies. Some important policy that has been in healthcare recently, healthcare promotion campaigns to prevent smoking, policies mandating child restraints, disease prevention services and immunization, enhanced mental health care, access to care, health information technology. We've all heard about HIPAA, reproductive and sexual health, and the Roe versus Wade controversy, gun violence, affordable care, and Obamacare. Healthcare issues that defined 2018, one of them was artificial intelligence. I don't know if you've read much about it, but it is just as much as fascinating as it is scary. Medicare Advantage, the opioid crisis, cybersecurity breaches, patient experience and patient engagement. I think no matter where you're working now, those are two very important issues in your facilities. Price transparencies, disaster preparations, tax reforms, the ACA. We're going to be talking a lot about the ACA in this course, and repeal and replace. Entitlement reform, prescription drug pricing, AIDS relief, value initiative, and then some individual healthcare workforce programs, nursing and physician shortages, staffing ratios, workplace violence, regulatory standards, and hospital security. So all very important state, federal, facility, and global issues. So where can we find information about healthcare policy that's pertinent to us as registered nurses? I'm going to take you over to the ANA website and just show you a few things. So here we are at the ANA website. All I did was simply Google ANA, and you can look all around on this website. There's a menu up here on the top. I'm going to go to Practice and Policy, and we'll look at a few things here. So we can go to health policy, which talks about health system reform, health IT, professional issue panels, regulatory and care coordination, all that stuff that we just said was very important to policy. And advocacy. We're going to talk a lot about advocacy in this course. And they talk here about state, federal advocacy and certain political action committees. I think that there's one whole week that we spend talking about PACs. There's some things in here about public health nursing, which is has a lot to do with policy, nurse staffing, violence and civility, all kinds of things. So if I go into the health policy, we can see here that it's broken down again into a little menu over here. And then each one of these things that we want to look at, we can go into it a little bit more. So if we want to look at the health system reform and what's going on with this now, can you believe it or not, 2010 Patient Protection and Affordable Care Act, we can click here, certain agencies and regulations, things about Congress and laws, CDC, FDA, CMS, all those kinds of things. We can find out more about that. Health information technology. So I show you this just so that you know that it will be a tool, just one of the tools. You're going to be looking at a lot of other things online, and there's a lot of articles and other sites that we've left for you. But I show you this as an important one because it is specifically to do with nursing. So again, I welcome you to the course. I am going to do weekly videos introducing the weekly competencies and talking a little bit about the discussion in the assignment. And then I also usually do another video at the end of the week just to brush up on the core concepts and make sure that everybody understands the important things that we need to take out of that. I encourage you to ask me questions. Please, you can email me anytime. I do look at my BayPath email at least in the morning once and once in the night. We can have any kind of conversation you want. We can talk on a telephone. We can do a Skype. We can do a Zoom if you'd like to talk. But please make an appointment with me first because I'm not always available to answer my phone. And thank you. We will see you soon online.